So we do it in the mid-clavicular?
No.
We have to
You have to
find apical impulse.
Because the thing is, when we check the upper, we're going from the upper to the lower part. Here we find the lowest intercostal space where we have the resonant sound to check to find the down. But over here, we are checking the left border, and it must be the lower line of the heart. Where's the lower line? Where's the apex? Right? So firstly, you have find the apex. That's the lower part of the heart. So you find the apex because it could be in the fifth intercostal space, or it could be in the sixth intercostal, or in the fourth one. So you find the right. Now you find this intercostal space. You don't have to count it at this moment. I mean, when you do the exam, because when you do normally examining of the patient, you will check it because you have to concretize the apical impulse. But when you do the exam and when you do the percussion, you don't have to say that apical impulse in the fifth intercostal space. No, you have to do the percussion over the same intercostal space where the apex is. Okay. So when you localize it, that is your intercostal space, and you will do percussion starting from the anterior axillary line. Just remember that intercostal space is not horizontal; it's going up there. So starting from the anterior
axillary line,
you will go
down.
Do
we need to ask the patient to?
Yes, that would be easy for patient. Yes, to put the hands up.
Okay.
No, that's how it goes.
Okay.
Yeah. Be more quiet. See?
Relative.
So, sometimes the relative border is exactly at the moment of at the position of apical impulse, but normally it's 2 centimeters to the left. That's what we find here. Here's the apical impulse. That's here we find the relative border. So now from that position, you try to find very quietly the absolute border. Yeah, that would be good. So once again, show us the relative border. No, very, very quiet. I would say doing like this. You see the dullness? And now quiet.
Oh.
It's very, very close, you know.
Okay.
Changes, very small changes. And you know, I almost even put my finger out because they are very, very close. So I just like sling with the skin. You see the dullness? And now the quiet one. Okay?
So the first one is
Relative, and the next one is absolute. So you have to know the borders. Over here we have the left atrium, right? Over here we have the left ventricle. Over here we have the right ventricle, right atrium and
Right ventricle.
No, right ventricle is more to the center. Sorry?
Vena cava.
Vena cava, yes.
Superior vena cava.
I'm trying to remember. So that's the right border. Left atrium, left ventricle. That's relative borders. And what is absolute border? Absolute dullness means that we have the area of the heart that is totally not covered with the lungs, without any lungs over here. And this is the projection of right ventricle. So all the absolute borders are done with the right ventricle. That's why when we try to palpate right ventricle, where we put our hand? Over here, fourth intercostal space, left side of the sternum.
Sun.
So that's the projection of the right ventricle. That's how we find it. Normally, third intercostal space, that is relative border, fourth intercostal space, this is absolute border. 1 centimeter to the right from the relative border and right part of the sternum. So that's the projection of the right ventricle. Okay?
Okay.
Good.